Hashimoto's thyroiditis is an autoimmune disease that affects your thyroid gland by gradually destroying. Your thyroid helps produce hormones that regulate lots of different processes in our bodies. This can be caused from a range of factors. This can be seen in molecular mimicry, where a person's immune system develops an autoimmune response to pathogenic antigens that look like human proteins. Genetic susceptibility. Most genetic variations found to date are thought to have a small effect on an individual's overall risk for this condition, or comorbidities, so any other autoimmune diseases such as Crohn's disease or Graves' disease. One of the main things I noticed for Rebecca's case study is her pathophysiological cause could be her genetic susceptibility or her comorbidities, considering that she has a family history of autoimmune diseases. Now that we've looked at the pathophysiological causes, let's look at the thyroid-releasing hormones that intake this. In Hashimoto's thyroiditis, the lymphocytes, which are our T and B cells, react to the self-thyroid antigens. These then cause the lymphocytes to infiltrate the thyroid gland because of the reaction. Once this happens, our T cells are activated, then our T cell-mediated destruction of the thyroid gland begins. Once the destruction has begun, the T4 and T3 cells decrease secretion and production from. Take a closer look at when lymphocytes infiltrate the thyroid gland. Once this begins, the B cells are activated and an increased production of anti-thyroid antibodies begin. These are detectable anti-thyroid antibodies such as antithyroglobulin and antithyroid peroxide. Now let's take a closer look as to what happens when the T cell-mediated destruction of the thyroid gland begins. Once this happens, inflammation and the decrease of normal thyroid gland architecture begins. So it starts to decrease and the inflammation begins to get greater. If significantly destroyed, the thyroid gland will present as atrophic, which is the smaller, more firm. Whereas if it's significantly inflamed, the thyroid gland will present as goutia. For Rebecca, our patient in this instance, hers is significantly inflamed, which is why it's presenting as goutia, which is enlarged and firm on touch, mild tenderness on palpation as well. Let's take a closer look at the decreased secretion and production of T4 and T3 cells and what happens when that begins. First, we can have a slower metabolism. So that's where the generic symptomology of Hashimoto's thyroiditis begins to present. So things like the hair loss, the dry skin, the fatigue, and the weight gain can all be caused by a slower metabolism. What can also happen is a negative feedback loop, which is the inhibition of the pituitary gland coming in. This causes the increased secretion of TSH. Thyroid stimulating hormone. Let's take a look at some of the risk factors and causes for Hashimoto's thyroiditis and the modifiable and non-modifiable risks. First, let's explore some more of the modifiable risk factors. When someone's diet has an increased production of iodine, it can cause Hashimoto's thyroiditis to increase, which can accelerate the thyroid cell destruction, making the disease progress further. Increased stress isn't a cause of the disease, but it's definitely a risk factor that can change and worsen the disease. The impact of stress on the thyroid occurs by slowing the body's metabolism down. This can be the same for someone's lifestyle, which is more sedentary, which can also be an example of things like inadequate sleep causing more stress on the body, slowing our metabolism down. Now let's explore some of the non-modifiable risk factors and causes of Hashimoto's. The first non-modifiable risk factor is similar to many autoimmune diseases. The thyroid dysfunction is more common in women than men. The female predominance is attributed to sex differences in our immune function. Hashimoto's is a progressive disease over time and with age, which is why a lot of people don't present with symptoms until around 30 to 50 years of age. Similar to gender, pregnancy can also be a risk factor and cause for Hashimoto's. This is due to the shift in pregnancy of your immune function during the third trimester or particularly during childbirth. It can also be caused by blood sugar imbalances for those with gestational diabetes. Any other autoimmune diseases can also be attributed to a risk factor of Hashimoto's due to the low immune system already not coping. Levothyroxine gives your body the ability to produce its own thyroid hormone, which is why the drug class is a hormone. Its mechanism of action is once ingested in oral form, T3 then binds to the nuclear thyroid hormone receptors in the cell nucleus, leading to the activation or repression of the specific genes. It acts as a synthetic replacement for the T4 hormone. By providing the body with T4, this alleviates the symptoms associated with Hashimoto's thyroiditis, such as weight gain, cold tolerance, cognitive impairment, and fatigue. Nursing interventions may include monitoring for signs and symptoms of overtreatment. This can mimic hypothyroidism symptoms such as anxiety, palpitations, chest pain, tachycardia, sweating excessively, changing your appetite, and weight loss. With our patient Rebecca, it will be educating her about what signs to look out for when taking her dose of levothyroxine, to have her understand when to stop taking the medication, go back to the endocrinologist, or call 000.